Good afternoon, good evening, and welcome everyone joining us today from across the Eastern Mediterranean region and beyond. This is Baher Dessouqi. I am a senior technical specialist working for EMPHNET, and I am pleased to co-moderate this session today alongside my colleague, Dr. Maysam from EMPHNET also. On behalf of EMPHNET, it's our pleasure to welcome you all in EMPHNET WEBi series. This is the 55th session under the theme One Health Implementation in the Eastern Mediterranean region, the missing piece of the puzzle. This webinar comes at a critical time of our region in which the Eastern Mediterranean region continues to face complex and interconnected public health challenges driven by zoonotic diseases, antimicrobial resistance, food insecurity, climate change, population displacement, and ongoing humanitarian crises. These pressures highlight the urgent needs for integrated, multisectorial, and sustainable approaches to health security. The One Health approach, as you know, linking human, animal, and environmental health, has been widely recognized as the framework for strengthening preparedness, prevention, detection, and response to emerging health threats. However, despite growing recognition for the One Health implementation, it still faces several operational and structural challenges. So, in today's webinar, we are trying to explore how can we move from the One Health as a concept and policy direction to One Health as a fully operational and sustainable practice across the region. So we are honored to bring together our distinguished speakers from the region and across the globe. They will share with us their insights, their experiences on how to strengthen the key capacities for effective One Health implementation. So without further ado, I am pleased to hand over to my colleague Maysam, who will introduce the session agenda and our distinguished speakers. So please, Maysam, go ahead. The floor is yours.
Thank you, Dr. Baher, for your opening remarks and for setting the stage for today's discussion. Good evening, good afternoon, everyone. My name is Maysam Abdah, Project Manager at EMPHNET, and I'm pleased to be with you today. Before we begin, I would like to briefly go over the structure of today's webinar. We will start with 4 experts' presentations focusing on key capacities required for effective and sustainable One Health implementation. Following the presentations, we will move into a panel discussion and audience Q&A session before concluding with key takeaways and closing remarks. As a housekeeping note, we encourage all participants to actively engage throughout this session. Please feel free to submit your questions at any time using the Q&A box appears on the screen. We will collect questions during the presentations and address as many as possible during the discussion session. Also, when submitting your question, you may indicate whether it is directed to a specific speaker or open to the panel. We will now move to our first thematic presentation. Our first speaker will address the critical role of leadership, governance structure, and institutionalization in enabling effective One Health implementation. It is my pleasure to welcome Dr. Hiba Mahrous, One Health Regional Focal Point at WHO EMRO. Dr. Hiba is a veterinary epidemiologist holding a PhD in microbiology, with over 20 years of national and international experience in One Health and zoonotic disease surveillance and response. Throughout her career, Dr. Hiba has contributed significantly to strengthening multisectoral collaboration and advancing One Health approaches across countries and regions. Today, Dr. Hiba will present One Health leadership and governance in action. Dr. Hiba, it's a pleasure to have you with us today. You have 15 minutes for your presentation and the floor is yours.
Thank you so much, Maysam and Dr. Baher for the, this kind invitation. Can you hear me well? And can you see my slides as well?
Yes, Dr. Hiba.
Yes, we can.
Just please make it in the presentation view. Thank you.
Okay, so it's my pleasure here to join you in this webinar today. My name is Heba Mahrous. I'm the One Health focal point for WHO EMRO. So allow me first is to, define or remind ourselves about the One Health concept. What does it mean? And then we will dig into other main concepts for the One Health, which is the leadership and governors. And then we will end our brief presentation on some global and regional examples in terms of this leadership and governance implementation at concrete examples from the regional and national also perspective. So first of all, regarding the One Health concept, you can find a lot of definitions for the One Health, but I have chosen the very recent one, which is has been figured out and tailored by the One Health high-level expert panel. And this is really the concept that involve the three sectors or the three main pillars of the One Health, which is the human, animal, and environment. So by this definition, by the OLAP definition, it defined the One Health as integrated unifying approach, which recognizes that the health of humans, animals, plants, and the whole ecosystem are closely linked and interdependent. So the One Health, by this definition, serves a lot of technical areas that need this coherent collaboration and coordination across multiple disciplines. So as you can see from these slides, the implementation of the One Health will add value to areas like antimicrobial resistance, climate change, zoonotic diseases, food safety, even the chemical chemical pollution, and a lot of these areas that needs collaboration and involvement of multiple disciplines. If we speak about the One Health, we always, mentioned that it revolves around 4 C's, which is communication, collaboration, coordination, and capacity building. And this is part of the theory of a change that also the OLIP, the high-level expert panel have, recently developed. The main pillars from this is collaboration and coordination, and even further from coordination and collaboration into the partnership. So the collaboration means that is a cooperative arrangement between different sectors, between the human, animal, and environmental health institutions, organizations, and all of these aims to work jointly towards a common goal. And this also will have the impact on improving the global health. When it comes to the partnership, it goes beyond such collaboration, beyond just work jointly, and go far into sharing resources and sharing responsibilities to achieve these common goals and objectives. And for the One Health teams from these multiple disciplines, they have to work with a common vision and team spirit. I have said this because this all, part of the responsibilities of the leadership of the One Health. When it comes to the leadership, the One Health leadership, we can define it as inclusive, participatory, and horizontal management approach. And this approach and this leadership is mainly designed to coordinate the different teams, the multidisciplinary teams across the human, animal, and environmental health sectors in the countries. And the leadership, it emphasizes the systems thinking, emotional intelligence, and cross-sector collaboration to address these complex global health challenges that lies at the human-animal environment interface. And by having a strong leadership, really, it leads to breaking down the departmental silos, enabling this cross-disciplinary collaboration, which is a mandate and required to prevent pandemics, as we could see from the COVID, and these days we're suffering from Ebola as well. So all these problems need a very strong leadership. And this strong leadership will do what? This strong leadership should set the shared goals for all disciplines, work together, set unified priorities, and also ensure accountability and transparency across all sectors. Also add to the building trust and ownership among the different stakeholders that, responsible for taking care of the health shared at the human-animal environment interface. And finally, which is so important, mobilizing resources, even financial or human resources. And these resources and donor support is very crucial to implementation of the One Health approach. When it's coming now to the second piece of our presentation today, or the second key towards the implementation of the One Health, which is the One Health governors. What we mean by the governors is the structure, is the regulations, is the legal frameworks that all can help in having very strong enabling environment at the national level, subnational level, regional, and global level to move the One Health agenda and to promote and support all the implementation of the One Health related activities. From a global perspective, take in mind that the leadership and governance is very important to move the One Health agenda globally. The four organizations, FAO, WHO, WHA, and UNEP, had unified their efforts and formulated the quadripartite, as you know. And we started since 2023 to have this quadripartite. Before we were working as three organizations, giving some sort of weight to the environment, but not as the human and animal health sectors. So it was called only tripartite. By adding UNEP, we had unified the four efforts and call it quadripartite. We used to have, since 2023, annual executive meeting. We discuss all priorities that can support all member states to move with a One Health agenda. This is a very recent example on the governors and leadership and political commitment that really very efficient in supporting countries to implement One Health as one of the key efficient tools or approaches that can help them controlling and preventing the spread of these health threats, including zoonotic diseases, EMR, and even the threats to the food systems as well, and the climate change. So this one, which is the One Health Summit that was recently, organized in Lyon with participation from more than 20 ministers, the president of France, and a lot of, the senior people that supporting the One Health agenda was very, very important to move and to provide resources as well to the implementation. From a regional perspective, we can be considered as the first WHO region that succeeded to have a resolution in the regional committee that is very committed to the countries and also the ministers and the RD to support all the member states, all the ministries, to advance implementation of One Health. And at the regional level as well, last year, we, as a quadripartite, the regional quadripartite, we signed what we call a joint statement of commitment between the four organizations. And this joint statement of commitment is to support all member states to advance the One Health as well. We had established what we call it multisectoral coordination mechanism, or in terms of our presentation, we can call it leadership and governance mechanism on how we, on how we can settle our own internal issues to support the member states. So we had this coordination mechanism, or you can call it governance structure, with different layers. The first one is the high one, which is the regional One Health Executive Committee, which is considered or consists of the regional directors of the four, or the heads of the four organizations. And then the second level, which is a coordination working group, which is a focal point of the four organizations. And then now we are almost there with establishing a regional quadripartite One Health technical working group serving zoonotic diseases, AMR, and food safety as well. In also advancing and support the member states to advance One Health, we had developed our regional quadripartite One Health action plan, and it has a very straightforward objectives to implement a comprehensive regional mechanism and also the efficient use of the One Health approach in the prevention and control of health threats at the interface, and finally promote the use of technology and tools for the joint One Health practices in our region. From the national perspective, we had developed this model and examples of how the national One Health platform should be, with specific TORs, with different options, different layers that can manage and oversee all the One Health related activities and implementation in the countries as well. So this is one example, like having the steering committee to oversee all the One Health at the national level. I'm sorry, and then have a coordination committee. And then the third layer, which is the most important one, which is the technical working groups involving professional staff from Ministry of Health, Agriculture, Environment, and other relative or relevant authorities or stakeholders in the countries to work on these different profiles under the umbrella of One Health. With this, governance structure that we provided to member states, a lot of countries within our region has succeeded to develop all needed legal frameworks and also establish the structure. So UAE, Pakistan, Iraq, Jordan, Egypt, Kuwait, Tunisia, Oman, Sudan, a lot of countries actually, they succeeded to have some sort of milestones, to have the leadership and governance of One Health well established at the country. So some countries, they started from the development of the National Action Plan for One Health to support the implementations. Other, they have a circular or decree with this structure very well in country context, matching country context TORs with specific stakeholders to be engaged. So a lot of really, milestones have been already moved ahead in the countries in the region to move this One Health agenda, more specifically the leadership and governors. Just to wrap up at the end, when we said we need to operationalize One Health in the country X or at the regional or at the subnational level, we always, revolving around these key pillars. And the first and most important one is the governance and leadership, setting all the milestones, having this legal backbone, enabling environment for the One Health to be implemented properly. And then coordination, collaboration, setting specific maybe software or information sharing across sectors, coordinating meeting and all these activities. Also joint planning and implementation of One Health relevant activities, plans, either for zoonotic diseases, EMR, food safety, or any technical area that under the umbrella of One Health, coordinated surveillance, and finally enhancing the workforce capacities to be able to take over all these assigned tasks under the umbrella of One Health. I stop here and I'm, free for any questions or at the end of the webinar. Thank you. I'm sorry if I speak too much. Thank you.
No, thank you so much, Dr. Hiba. Perfect time management. And thank you really for this insightful presentation and for clearly highlighting the importance of strong governance, leadership, and institutional frameworks in advancing One Health and implementation across the region. We will have our questions by the end of this session, and we advise everyone to put all their questions in the Q&A part. This important topic perfectly sets the stage for today's discussion. I will now move to our next presentation that will focus on the importance of workforce development and innovation in advancing sustainable One Health implementation. It's my pleasure to introduce Professor Hashmi Louzir, the former Director General of the Institute Pasteur in Tunisia. Professor Hashmi is a distinguished immunologist with an extensive career in research, public health, and scientific leadership. He led the Institute Pasteur in Tunisia for more than 15 years, during which he played a key role in strengthening research, innovation, and public health capacities. He has authored more than 90 scientific publications, led numerous internationally funded research initiatives, and mentored generations of researchers and public health professionals. He is also actively engaged in promoting the operationalization of the One Health approach in Tunisia and across the MENA region. Today, Professor Hashmi will present Strengthening One Health in the MENA region, Human Capital and Innovation. It's my pleasure to welcome you, Professor Hashmi, and over to you. Professor Hashmi, you are muted.
Sorry, this is okay now?
Yes.
Okay, thank you very much. Thanks again, Maysam, for this introduction. Good afternoon, and it's an honor to speak before you today. First, I want to express my complete alignment with the consensus of this panel. Our region, the Eastern Mediterranean region, and the wider MENA zone is currently facing public health threats that are unprecedented in their complexity, volatility, and deep interconnectedness. We are no longer dealing with isolated, predictable outbreaks. We are dealing with systemic vulnerabilities. Next slide, please. And this slide represents in my opinion, the four top One Health priority traits defining our regional landscape today. We have in trait 1 zoonotic and vector-borne disease. We live under a constant high risk of animal to human spillover driven by pathogen like MERS-CoV and avian influenza, alongside worrying resurgence of vector-borne illnesses such as dengue and leishmaniasis. They are heavily accelerated by ongoing regional conflict and regulated cross-border livestock movements. Threats to antimicrobial resistance. This is our silent pandemic. Drug-resistant superbugs threaten to completely collapse our already vulnerable healthcare systems. This crisis is fueled by widespread and regulated misuse of antibiotics in both human medicine and intensive livestock farming. Threat 3 for our region is climate change and environmental stress. Our region is one of the front line of global warming, experiencing extreme heat waves, rapid desertification, acute water scarcity. These environmental shifts alter insect habitats and force human, livestock, and wildlife to crowd around rapidly depleting water sources, creating dangerous hotbeds for viral transmission. Threat 4, it's food safety risks. We see a high prevalence such as salmonella resulting from integrated meats and dairy products. This is severely exacerbated by weak inspection infrastructure and frequent cold chain breakdown caused by poor storage and conflict-driven infrastructure decay. So next, please, next slide. This brings me to the core purpose of this contribution and why this specific tethering is so vital. Our primary objective today must be exploring solutions to transform noble intentions on high-level political frameworks into concrete, measurable field actions. Let us look at the hard truth. There is a broad universal recognition, both globally and explicitly within the MENA region and the EMRO region, of the absolute importance of the One Health approach. Everyone agrees that we must look at the interface of human, animal, and environmental health to fight zoonosis, antimicrobial resistance, food insecurity, and climate shocks. However, despite this conceptual consensus, actual implementation on the ground remains deeply fragmented, siloed, and isolated. This is a challenge we share with many other regions worldwide, but given our unique regional vulnerability, we cannot afford let to this fragmentation persist. Next, please. In my view, while structural governance and institutional coordination are absolutely fundamental building blocks, they are not enough on their own. Today, I want to direct your attention to the specific, deeply interconnected domains where we desperately need to focus our effort and scale up our investments. I firmly believe these three areas are the true operational determinant for building authentic long-term resilience against One Health threats in the region, but elsewhere. They are first, interdisciplinary education and capacity building. Second, localized research and development. And third, and most crucially, targeted innovation to deliver concrete, scalable field solutions. Let us examine how these pillars work together to transform our regional response. Next, please. So our first pillar is the promotion of education and the comprehensive development of scientific and technological capacities. If we want to break down operational silos in the field, we must first break down academic silos in our university and research centers. We must deliberately champion institutional interdisciplinary to train a new generation of professionals. This new generation must be fundamentally equipped to understand, analyze, and manage complex health threats right at the cross-section of human medicine, veterinary science, and environmental ecology. But we cannot stop there. In the 21st century, we must fully integrate data science, artificial intelligence, and social science also into this educational system in order to have a broad vision of what we need and what we develop in order to have more resilience against this One Health threat. By merging epidemiological data, climate modeling, and genomic sequencing, we can train data-driven One Health practitioners who do not merely react to outbreaks, but actively predict and prevent them before they cross the animal-human threshold. Next, please. The second pillar demands that we aggressively reinforce our localized research and development. To achieve true resilience, we must generate local knowledge and build local assets to solve local problems. The scope of required research is immense, but we must prioritize our most critical gaps. Let us be entirely honest. Our region suffers from a severe critical deficit in biotechnology infrastructure and local vaccine manufacturing capabilities. We saw during recent global health crisis how vulnerable this leaves our population when global supply chain tighten. Investing heavily in regional research and development for biotechnology, diagnostic, therapeutics, and vaccine development is no longer just a scientific goal. It's a fundamental pillar of national and regional security against One Health threats, against global threats, etc. We must establish regional network of excellence to develop medical countermeasures tailored specifically to pathogen and climate profile of the EMRO of our region. Next slide, please. The pillar 3, this leads to me our third and more vital catalyst, unleashing innovation. Innovation is the absolute bridge that transforms academic research and policy blueprints into real-world, operational field solutions. Without innovation, research and development remain confined to the laboratory, and education remains confined to the lecture hall. When we speak of innovation in the One Health space, we are talking about creating practical tools to solve practical problems. We need to foster an agile ecosystem that incentivizes public-private partnership and startup to develop breakthrough technology. Think of decentralized low-cost diagnostic kit that can detect zoonotic viruses or antibiotic-resistant strain within minutes in conflict zone or remote border areas. Think of solar-powered Internet of Things sensor to prevent cold chain breakdowns in area experiencing severe power shortages. Think of artificial intelligence-driven early warning platform that analyze animal migration patterns alongside climate data. This is what concrete action looks like. Next, please. In conclusion, distinguished colleague, the threats facing the MENA region are undeniably severe, highly interconnected, and rapidly evolving, but our response can no longer remain fragmented. By systematically investing in interdisciplinary education to build capacity, expanding regional research and development to secure our biotech independence, and driving market-ready innovation, we can shift from a posture of passive vulnerability to one of active resilience. Next, please, and the last one, let us move based on words, based on declaration, and based on isolated project. Let us build a unified, innovative One Health framework that protects the health, security, and future for our region. And thank you very much for your attention.
Thank you so much, Professor Hashmi, for this excellent presentation. You highlighted a very important operational gap, emphasizing the importance of investing in human capital, in education, research, innovation, and future-ready capacities for One Health. I can see actually a lot of questions from the audience, but for the sake of time, we will now move to the next key operational pillar of One Health: surveillance, integration, and coordination across sectors. It's my pleasure to introduce Dr. Yuandi Alimi, One Health Unit Lead at Africa CDC and co-lead of the African Union Task Force on Antimicrobial Resistance. Dr. Yuandi is a veterinarian and public health leader with extensive experience advancing One Health implementation across Africa. She has been instrumental in developing and implementing continental strategies that integrate human, animal, and environmental health. Under her leadership, Africa CDC has established several flagship One Health programs and strengthened the capacity of African Union member states to prevent, detect, and respond to public health threats through coordinated multisectoral approaches. Thank you for joining us, Dr. Yuandi. We are eager to hear your presentation. The floor is yours. I think we lost Dr. Yuandi. Maybe we can move to the next speaker and return back to this presentation with Dr. Yuandi. Okay, so for the sake of time, we will go for the next presentation and turning into a critical enabler of long-term success, sustainable financing, investment prioritization, and innovation for One Health implementation. It is a pleasure to introduce the next speakers from Food and Agriculture Organization, Dr. Fernanda Doria and Ms. Catherine Tyler. Dr. Fernanda is a veterinary epidemiologist and data-driven surveillance expert with extensive experience in early warning systems, animal health intelligence, and One Health surveillance integration. Her work focuses on strengthening the use of data, analytics, and digital tools to improve early detection and response to health threats at human, animal, and environmental interface. Also, Ms. Catherine Tyler, the One Health Strategic Partnership Officer at FAO, in her current role, she supports the design and implementation of FAO's One Health Priority Program area, as well as the quadripartite One Health Joint Plan of Action. She has played a key role in establishing a major financing mechanisms for One Health and antimicrobial resistance, including the quadripartite EMR multi-partner trust fund, and contributes to global investment initiatives such as Pandemic Fund and One Health investment planning efforts. Together, Dr. Fernanda and Ms. Catherine, they will present FAO's role in policy interventions and investment leverage. I will hand it over now to my FAO colleagues to take us through their presentation.
Good afternoon, everybody. I hope you can see the screen. I'm not sure whether I'm supposed to share the screen or others are, but can you see it well? Because is that all right with you?
It's not in presentation
Yes, we can see it.
Good. And it's a full screen, not showing lots of different parts, correct?
It's not in presentation mode. It's not a full screen.
I'm not
You may need to swap the screens.
Okay. So apologies, I didn't practice this earlier. Okay, so is that okay now?
No.
No,
it's not in the presentation mode. Catherine, we can present it from our side.
Oh, that would be better. I really would appreciate that. Okay, thank you so much. Sorry, multiple screens and multiple tasks. Okay, well, great to see you all, and it's lovely to be here with Fernanda Doria, my colleague. So what we would like to do is really talk about basically policy turning into investment leverage, because everybody is concerned about sustainable financing and how do countries in particular and regions indeed, find those funds to really do, if you like, a one health. But we're going to do a deep dive also with Fernanda on, a very important aspect on collaborative surveillance. So here you have on the next slide, thank you, we basically have our contact details. We're always very ready to be in touch and follow up with you. So I'm going to whiz through some slides and maybe too fast, but you will get these slides anyway. So just to start off with the next slide, just to let you know that FAO, as you might know, the Food and Agriculture Organization, works, as was said earlier, very closely with the quadripartite, that is WHO, UNEP, and indeed WOA. And we are not only present, as I am here in Rome in headquarters, but we have 5 regional offices, and we indeed have over 130 country offices. So we have quite a footprint on the ground, working with ministries of agriculture and other stakeholders. If you look at the next slide, indeed, we have in the heart of our strategic framework, under better production, producing food better, looking at agri-food systems and how they produce better, we infuse a One Health approach. So whether we're looking at antimicrobial use, or whether we're looking at fertilizers, or whether indeed looking at how we raise animals, or indeed find out what diseases animals might be spreading. The next slide, we also relate to the quadripartite, and many of you will know this inside out, but of course the quadripartite joint plan of action is there to inspire countries and regions to adapt, I would say, and adopt a One Health approach. I don't need to say much about this because you likely know better than me. But basically it's around focusing in on key threats, as well as working at the high government level, through to organizational development and data and knowledge exchange, which Fernanda will touch on more detail. So I want to really focus on how to turn policy into action with the next slide. And COVID happened, and now we've had Marburg, Mpox, Ebola happening. All of these are big global threats, local threats, and then there's also those endemic diseases and prevention measures that we need to take at every level. But often when there's a global event, there's a lot of noise around it, and the G20 and the G7 and many countries begin to sort of assert action. And if you look at the World kind of Economic Report, we know that disease threats or outbreaks were very high on the list after COVID, which has sadly sunk down because there are so many other priorities out there, including some of the conflicts that we're seeing around the globe. So spending, does follow policy and advocacy and political will. So whether it's at local level or at global level, there needs to be a trigger, and that can then trigger policy into investment leverage. So the next slide, I'm not sure who's entirely on the call, but I imagine some of you from governments who will often say to us, oh, sorry, the previous slide with the arrow. Oh, we did that. Sorry, it's this slide with the apple. Sorry. We got that. Okay, good. So, when you talk to governments, they often say from the ministries of finance, we've only got this much budget, and where am I going to put all of that when we're coming with all these new frameworks, whether they're being, recommended from global, regional, or national level. So there's lots of, things that governments need to do, but they all require prioritization, and they all require resources. And so that apple really gets chomped when we try to put all these things on the government desk. And of course, it can't be only the government who pays for it. But let's have a look at the next slide of national budget cycle. So if we're going to influence domestic spending, and it was really good to hear from Tunisia there on your prioritization, you need to get those very bankable priorities rather than big strategies. Of course, the strategy comes and the policy comes, but they need to be made bankable, and also an economic investment done to come into the strategic programming cycle of the national budgets, because you're wrestling, across different departments and as we've said before, the different priorities that are emerging, and we have to show those results. So that's something we do as a UN system, is really support the policy landing into a prioritization process and seeing what domestic resources can be leveraged. Next slide is the fact that, it's not only going to be domestic resources, and we know that countries vary vastly between low income, fragile states, and I think you're in the EMPHNET region, you've got vastly different countries, high income, through to more fragile contexts. But, one has to look at the entire spectrum of financing. It's not just typically, as we've just said, from the governments. It's not either anymore typically from, if you like, the bilaterals, the resource partners, the so-called donors. It's also from the investment banks. It's also from private sector sources and innovative forms of funding, where maybe even taxation measures can support some sustainable ends towards One Health. So next slide. What happens often is resources get siloed because you have different departments, particularly at national level, but you also see this across the region and into a global context where, whatever plans come out tend to be sector siloed. But as you heard from our WHO presenter, One Health should at least be 2 or 3 healths together if we're really going to call it One Health and have this collaboration across. So somehow in the system, we need to have a system approach to bring and pool budgets together. And I have heard of some innovative mechanisms, not only at global level, I mean, the Pandemic Fund, the AMR, Multi-Partner Trust Fund, a lot of these big funds tend to be cross-sectoral and funded from many different budgets. But at national level, we even hear of governments pooling some money to encourage working together, and there's often that incentive, as you know. So also it's the fact that we can't just rely on those public sector monies, but also where can we bring in the private sector? That's a whole other new conversation, but how can we do public-private partnerships? How can we make a lab public and private? How can we encourage them to invest in vaccine development if there's a business case? So it's really working across the spectrum of funding flows. The next slide is having, and this is, something that we all need to think about, whether we're in a big organization like a UN system or, whether we're indeed working at country level, or even if we were a CSO, a community-based organization, is that often money can be and that's the word donor, investor-driven, which can be fragmented, right? And then you can have small and isolated projects that don't join up into a sort of more umbrella program approach that has bigger and wider aims. So, that's something to think about also when you're trying to program and get resources from multiple sources. So very, very quickly, I just want to whiz through the next slides. That's a case of Bangladesh, and Bangladesh, is a wonderful example of the government inviting a One Health, if you like, a strategy and prioritization approach. And when you look at the stats here of 1,000 people per square kilometre, 180 large ruminants per square kilometre, and then you look at the number of chickens, you can imagine this is a real One Health, environment. So what happened there was we worked together with the Quadripartite and with the World Bank and, of course, the government departments and others through the One Health platform, and then the next slide, to really come up with a new and building a lot, because Bangladesh has been very strong on their One Health framework and institutionalization, but building afresh on, what is it that we want to achieve, and being inspired by the new One Health Joint Plan of Action. And through a prioritization process, the next slide, Bangladesh came up with actually not hundreds of investment cases, but a clear set of investment cases that were then also basically examined from an economic perspective. So economic analysis done to show the return on investment of investing, for example, in AMR reduction or use, let's say responsible use, through to looking at vector-borne diseases and others. You can see there's a whole script of things there. And this was complemented by looking at the international and the local investor landscape. So trying to matchmake those cases with potential sources of finance. So last slide is really the resulting of, what Bangladesh managed to achieve through this prioritization exercise was leverage from the banks, concessional loans, but also actually getting funds from the Pandemic Fund and also putting their own resources to match. So I don't want to spend long now on the next slide, but essentially Bangladesh and many other countries around the world, including in your coverage there with EMPHNET, have actually been successful with the pandemic fund to increase collaborative surveillance labs and workforce. And this is also all about One Health. And of course, it's all about leveraging more, because there has to be a ratio of $1 of pandemic fund leveraging roughly 5 or 7 other dollars, whether they're from domestic or loans, grants, or indeed even the private sector engagement. And last slide, what happens there, and going back to the arrow that I shared earlier, sorry, this is the slide that shows the countries, but not much time for that one, but you'll get the slide. Then the last slide is really showing, well, how was the pandemic fund set up as a global vertical fund? It was really as a result of COVID, G20, a lot of advocacy, and then, you know, this was set up as an incentive to really invest where you know, surveillance, etc., and response had failed, to really show that there needs to be some sustainable financing for these areas of work in the grand scheme of things. So it's a One Health approach, but governments are in the driving seats. Governments need to say where they want those priority investments to go around the log frame that the pandemic fund shares. So one of those investments is on collaborative surveillance, and I wanted to pass the floor quickly to my colleague Fernanda, who will share basically on some examples at country level how collaborative surveillance is working. And some opportunities and challenges ahead. Thanks a lot.
Yeah, I apologize. We had a synchronization problem, so my slides are not at the end of Catherine's presentation. But I'm very conscious that we've already used our time, so I will just give you a taste for, as Catherine said, some specific examples and try to stay with the theme. The main message I wanted to pass is that, as Catherine showed, One Health is a core element of our framework, and that's because as an organization concerned with animal health, we see animal health as a big blind spot on disease preparedness and response. And I want to also acknowledge the questions in the Q&A have been very interesting. I'm not sure we're going to be able to answer all of them, but those are the right questions to be asking, right? How are we bringing One Health in a way that is sustainable? The collaborative surveillance framework talks about collaboration across sectors, but that very often overlooks the animal health. So what we've done at FAO recently is translate the United Nations Disaster Risk Reduction Framework towards a framework for reduction of the risks posed by animal health threats. The document is very comprehensive, and it helps countries understand what are their target goals in terms of monitoring risks, detecting diseases earlier, doing communication with that information, and then supporting decision. I won't go in details of this. I will just say that we've tried to organize our offer to countries around those 4 dimensions of combating risk. And the one example I won't extend too much because of the time is for the digitalization of animal health surveillance systems through the adoption of the Event Mobile application, which is an app to collect surveillance data directly on the field. And we have some good success stories in the EMR region. The main point I wanted to bring is that someone said this in the chat as well, that bringing the One Health perspective will improve early warning for diseases in general, will protect livelihoods. And at FAO, we worked on this framework that is a goal-setting document, but the journey there depends on each country. So just to reinforce the message from Catherine on the sustainability and resourcing this pathway there, what we work with is creating global frameworks that countries then can own. They can find their own way there. They depend on investing their own resources, but we provide them guidance so that those resources are well employed. Where possible, we work with them to find money for catalytic initiatives so that we can get them in movement, but we focus on adoption that needs country ownership so that they are sustainable. As much of the cost of systems as can be shared across countries, we do it in a global level. So we develop these global systems so that we can cost and finance the maintenance, but every country still needs to resource the adoption. We see One Health in this context not as an extra layer of resources needed, not extra funding, but as a way to create synergy across countries that will finance itself. There's a lot of questions on the chat about this, and I think it's a discussion that we welcome here today. We look forward to the question and answer part, but I'll stop here in the interest of time. Thank you.
Thank you so much. Thank you so much, Dr. Fernanda, Ms. Catherine, for this highly insightful presentation. It's highly important to align the One Health priorities with the strategic investment planning. And we truly appreciate the practical perspectives you shared on how countries can better position themselves to attract investment and strengthening One Health system. Also, thank you for bringing a real-life example. It was really interesting hearing about the Bangladesh example. And I know there are a lot of Q&A waiting for you, so I will go back to Dr. Yuwandi now for the last presentation. Dr. Yuwandi, I hope you are back with us right now.
Yes, thank you. I am.
Okay, so Dr. Yuwandi, the One Health Unit Lead at Africa CDC and co-lead of the African Union Task Force of Antimicrobial Resistance, will now deliver her presentation on the surveillance, integration, and coordination across sectors. The floor is yours, Dr. Yuwandi, and welcome again.
Thank you very much, and good evening from Addis Ababa, Ethiopia. Thank you so much to the participants, and good evening, good afternoon, and good morning, depending on where you're joining us from. I think this is a critical conversation, and it is a pleasure to have Africa CDC as well as Africa Union present on this. It is also a pleasure for me, being an OLEP member, to really re-emphasize what Dr. Hiba has presented around the One Health definition. Ladies and gentlemen, I think most critically, when we think about One Health, as you know it's human health, animal health, and environment. But more often than not, we forget that in principles, those are just sectors. And it's the people who make those sectors. And one of the things that we tend to do is really emphasize the impact or the value of having communities as part of the core system or part of this ecosystem of what a One Health approach should look like. But most significantly, I think over the past years, a few things as we have always done with our different sectors, is really focusing on the infectious diseases, the threats to health ecosystem, without also exploring things like the need for clean water, energy, air, and safe and nutritious food, while taking into the context of climate change as we look at the overall contribution to sustainable development. So as a start for my session is to understand that One Health is not just bringing sectors together. It is the core of how we operate. Working together is the core of how we operate. It's just that we have been defined by different silos. At Africa CDC, we take it a bit just simplistic, trying to look at it as a bit of a collaborative, multisectorial, and transdisciplinary approach for us to attain the optimal health outcomes for people, animals, plants, and their shared environment. Like my colleagues have alluded to, there's several challenges that require a One Health approach. We've talked a bit about AMR, climate change, food safety, and security. But occupational health, mental health, natural disasters, vector-borne diseases, as well as zoonotic diseases really require a transdisciplinary, collaborative, multisectorial approach. At Africa CDC, across the 55 member states, we've tried to prioritize where the numbers are, where the greatest impact of this One Health challenges, as you may call them, are really. And already across our member states, we have identified zoonotic diseases, antimicrobial resistance, food safety, as well as climate change. Ladies and gentlemen, it's quite critical that we take a pause and look at these numbers. I will go into my session to really focus on primarily zoonotic diseases, but I wanted to take a minute to pause and look at antimicrobial resistance, as well as food safety and climate change. I think some of my colleagues have already alluded to the numbers, but significantly, this is what the numbers look like for the African continent. Let me give you a context. For example, the numbers already show us that about 1 million Africans are dying as a result of AMR. Our population currently across the continent is about 1 billion. That's a significant percentage of Africans at risk. Similarly, you look at the numbers when you think about food safety and food security issues, but also the impact of climate change, which is an almost irreversible impact across our ecosystem. So very quickly, these are just some of our strategic documents before I go into the session that really looks at surveillance. I'll give a bit of a timeline. I think colleagues have already alluded to the importance of zoonotic diseases, vector-borne diseases, neglected tropical diseases, AMR. But you can see from 1969 up till 2024, which this slide currently looks at, you will see the significant outbreaks that we have seen on the African continent. From east to west, to central to north, this is what it currently looks like on the continent. I would like to focus particularly on looking at the value of a One Health approach to coordinated surveillance, with a focus on zoonotic diseases, which I will be able to use practical examples such as the ongoing Ebola outbreak, which is very relevant to the discussions we are having today. You would wonder that how can a disease threat or a sort of a group of diseases consistently put a continent at risk with no clear interventions that have been put in place? The numbers are clear. As Africa, you can see the numbers. For example, on this map, this is a map of 2019 to 2020, where at Africa CDC, we use our data systems to map out the zoonotic outbreaks that are being reported across our member states. And you can see across the slide, a few countries reporting 1 or 2, and a few other countries not reporting at all. In 2022 to 2023, with a similar event management system, we look at the disease reporting across those countries in terms of the zoonotic disease outbreak. It doesn't get better. We look at what it looks like now from 2022 to 2025. Significantly, we see our member states consistently reporting not just events, but also outbreaks of zoonotic diseases. Of course, you know the popular zoonotic diseases that we have suffered as a region, as a continent, things like COVID-19. I believe that there have been other examples that have also been presented. But in the current context, looking at Ebola, which of different strains we have reported outbreaks across our continent. One of the crucial things that as a One Health discipline or One Health group, we need to start thinking about is also the effect of climate change in terms of driving these outbreaks. As a region, we are blessed with the biodiversity. We have the right population mobility. We have a young population. Our cultural practices, such as our agricultural practices, certain things like eating bushmeat, these are cultural nuances. To us, this is who we are as Africans. So these are some of the things that consistently drive some of these outbreaks. But most significantly is what we are seeing in terms of the impact of climate change across the different regions of Africa in terms of driving zoonotic diseases. So ladies and gentlemen, let's take a quick pause. We've said the value of One Health, but the most important thing is what tells us when this is critical. This is where the value of a One Health surveillance or a coordinated surveillance really brings and adds value to the conversations we are having around workforce, leadership and government, leadership and governance, where our financing and legislation should go. All of us on this call, I would like us to ask ourselves a significant question. 2020 was a bit of a shocking year for all of us. We saw the impact of zoonotic diseases, at least in our generation. We've seen several of them, influenzas, but COVID-19 was significant, putting the entire world at a standstill. 6 years after. What lessons have we learned? What One Health interventions have we put in place to ensure that these diseases that originate from animals we can make sure that we prevent any spillover into the human population? Again, emphasizing on what we saw with COVID-19. The science is almost as similar as what we are seeing with the current BVD outbreak. Again, knowing that this is a zoonotic disease, a spillover from potentially a fruit bat, the ecology of this has not been explored. You can see that the spillover happened maybe sometime at least 4 weeks before we even started seeing the widespread human-to-human transmission. At this point, of course, the spillover has already occurred. From the reservoir to the index case and sustained human-to-human transmission, and as we are seeing, cross-border transmission across DRC and Uganda. It gives us a minute to think about it. As long as we know the science, the virus always occurs within the wild cycle. But usually when we see some of these outbreaks is as a result of a spillover. So what exactly are we missing as One Health group of experts? Why is it that in less than 6 years, some of the lessons, some of the interventions, some of the investment that we have said that we needed for One Health has not been materialized to the point that we are seeing this ongoing outbreak? This is where the value of a One Health coordinated surveillance really comes in. We have said it years and years, decades and decades, over and over again, that it's crucial that surveillance investment are not only in the human health sector. For example, in this case, we could have been able to prevent potential widespread cases amongst humans if we were able to do an early detection, particularly in the wildlife sector. And as you will see with many zoonotic disease outbreaks, usually the agriculture sector or the environment sector is your point to pick where the spillover could potentially occur, prevent, and when it does occur, contain as quickly as possible. Allow me to present a bit of an ideology in terms of the question is, why is this not happening? Or when it is happening, how does this inform what we do around governance? For example, our data sharing mechanisms. But what does this mean for workforce, for example? And also, what does this mean for investment, such as financing? In an ideal situation, a joint coordinated surveillance should be able to pull in data both from the animal health, the public health surveillance data, including meteorological and climate data, vector and wildlife surveillance data, to be able to make sense out of it through visualization, analysis, and most importantly, a feedback mechanism for alerting. But beyond the spillover, where is the value of One Health when we think of outbreaks? Thinking about the potentials for multisectoral response outbreak, be it forecasting readiness. For example, we talk about zoonotic diseases a lot. We talk about food safety issues. We talk about AMR. How are we using meteorological data to guide that? For example, you cannot imagine, of course, cholera, there will be cholera outbreaks when we have frequent cyclones or extreme rainfalls. This is what we know, and this has been the pattern. Similarly, with the El Nino warnings, it helps us anticipate things like outbreaks, as we have seen in 2019 in the Eastern African region with the Rift Valley outbreak. Beyond forecasting readiness, it also gives us an idea of what early detection, like I mentioned earlier, could be. But yes, where we are missing some of the critical multisectoral response element is where the control operations as well as the rapid response should be. More often than not, we expect the agriculture sector to tell us, oh, we are seeing outbreak of Rift Valley in our sector. But what happens with the coordinated response? How do we work with the agriculture sector to deploy vaccines in the animal population? How do we put together a rapid response team that has the veterinary sector, the environmental sector, the anthropologists, and other relevant skill sets that are often usually missing in the response sector? Before we start also to expand into the control interventions that are relevant for humans. Ladies and gentlemen, it goes without saying that there is cost benefit, which alludes to what my colleagues from FAO had already presented. The earlier we are able to identify a spillover, the better for our interventions, the better for the economics of our countries, the better for the cost of prevention or the cost of containment, as we have seen with COVID-19, the West Africa Ebola outbreak, the Mpox outbreak, and several other outbreaks that will occur as we continue in our lifetime. So what can we do better? We need to start to think about how to prevent that spillover event from occurring. But beyond spillover event occurring, who is exploring the potential reverse zoonosis that could occur? For example, we saw that in the COVID-19 outbreak. With the current BVD outbreak, I continue to ask myself a question. If hunters, farmers, miners continue to interact with the wildlife, these are humans that are already that may have been exposed. What is the risk for that reverse zoonosis? And these are questions most often than not during outbreaks we don't ask ourselves as One Health experts. And this is an example of, for example, COVID-19, where we saw humans infecting the animals, particularly in the wildlife. And this is the evidence that we already have. And as a result, it's important that coordinated surveillance is not just animal health or animal sector telling human health, but a reverse or feedback loop across all of these sectors. Ladies and gentlemen, it goes without saying that all of us as the panel experts, we have really brought together the value of a One Health approach. I think the title of this webinar is really to think about One Health approach, not just as something we talk about all the time, but as a means for us to think about it like a jigsaw puzzle. We've been playing with the pieces for a long time. Maybe it's time for us to look at the One Health approach as a means that brings all of these pieces together. Think about your SDG goals, your universal health coverage. Think about our ambitions as a continent for more equity in global health, thinking about local manufacturing, thinking about access. All of this lie on the spirit of a One Health approach. It is multisectoral, cost-effective, and really helps us attain optimal health, not just for humans, but also animals and our shared ecosystem. So this really approach has been endorsed, not just it's been endorsed globally. In Africa, you can count on your partners, the quadripartite, the Africa Union, the Africa CDC, AU-ABA, AU-PANVAC, your regional economic communities, as well as several partners. I think my colleague already alluded to the forces, but I think it's important to reiterate that you cannot achieve a One Health approach without exploring those mechanisms that really bring us together. So we continue to strengthen surveillance as Africa Union and Africa CDC through some of the strategic documents, such as our event-based surveillance framework, our framework for One Health practice in MPHIs, and the Africa Union zoonotic disease strategy. A few things are important. It's important to empower the local responsible ministries or MDAs. In our case, we usually work with the MPHIs and the MOH, but really bringing them together to ensure that MPHIs don't sit by themselves. They have to be in the multisectorial One Health platform to ensure that human health can contribute to this One Health conversations. Surveillance really should lie on established system, and we continue to support the IDSR system to ensure crucial linkages across the sectors. The regional collaboration is important, and we continue to do that through our regional collaborating center based in Egypt, and where my colleagues have been supporting the several Northern African countries. As a matter of fact, my team just came back from Tunisia last week, where they were doing the regional technical working group for AMR, bringing all relevant sectors together to review national action plans, review surveillance systems, as well as stewardship plans across the sectors. Most importantly, we recognize global strategies, but it's also important that as a continent, as a region, and as member states, we're able to develop and adopt these frameworks to our context and ensure that we continue to build capacity, coordination, and advocacy. And these are some of the other examples of some of the strategic documents that come in from my colleagues from the QPT, which we at Africa CDC continue to support and advocate for the implementation. One Health issues are complex. Working together is not always the easiest thing. It involves multiple disciplines, different ways of operations, different mandates, and different areas of expertise. But it's really important for us to get together, not just governments, because a lot of times we're talking about sectors. We also require regional organizations. And I'm really grateful to EMPHNET for really putting together this fantastic webinar. But we mustn't forget private sector, academia, research, civil society, as well as international partners as we bring together and advocate a One Health approach. Thank you very much for having me.
Thank you so much, Dr. Yewande. Great presentation. Thank you for the valuable insight on strengthening integrated surveillance system and enhancing multisectoral coordination. Thanks for highlighting this missing piece of the puzzle. And I would also like to once again thank all our speakers for their valuable contribution to today's discussion. I will not take long for this part, and we will move to our panel discussion to hear the questions from the audience, and back to my colleague, Dr. Baher, who will be moderating this discussion. Over to you, Dr. Baher.
So thank you, Dr. Mason, and thank you once again for all our distinguished speakers for their insightful presentations and their valuable contribution to this webinar. So for all the participants with us in this webinar, we are having our distinguished speakers with us, and we will turn to the questions that was raised by the audience or the participants using the Q&A section. So I tried to do my best to guide this section efficiently. So I tried not to move question by question, but I tried to compile the ideas or the inquiries that were raised through the questions to make the best use of the remaining time in this webinar session. So please, Dr. Heba, if you can respond to this first question raised by more than one of our participants. They were asking that you listed a group of countries during your presentation that are having efforts on the ground in institutionalizing One Health and improving the governance in these areas. So how to strengthen this governance structures and governance mechanisms, even on the national level, and also to extend it to the subnational level as well. So please, Dr. Heba, if you can help us answering this question.
Okay, thank you, Dr. Beher. First, I see colleagues from Afghanistan wondering if Afghanistan had some effort. Yes, I just, mentioned very recent examples, but if I, going back to all the countries where there is multidisciplinary teams working in One Health for some diseases or one disease or one pillar, yes, we do have these multidisciplinary One Health teams in all 22 countries. So it was just an example. I didn't, forget any, but just a few examples. Yeah, for the milestones or the key pillars to have this leadership and the governors well established, I think having the political commitment and the support from the senior managers to move the One Health agenda in the country. This is very important. I could see from my experience working across the countries in our region is there's some teams are working very professionally at the technical level, but when it comes to any support needed from the senior managers, like it's a little bit there is some of the gap between these two layers. So, and the reverse in some countries, like we have a very limited maybe or limited idea about the One Health implementation, but we have at the technical level, but when we have this high political support from the senior managers, the One Health agenda really moves and advances very quickly and very well established. So having said that, the political commitment and setting all the legal frameworks, having some sort of formalized agreement between the sectors with very specific rules and responsibilities for each one, This is very important. In addition to this, also having prioritized list of threats or diseases to collaborate on. This is very important because when we say we need to collaborate, we have to have a very clear priorities to work on. So priority list of diseases is also one of the key milestones that the countries need to have to advance the One Health implementation and to have this coherent collaboration across sectors very well structured and programmatic, and they can have some sort of M&E plans as well to follow up on the implementation of the One Health. So the leadership and the governance structure, when it is clear, have the legal framework set, have the different teams working with specific rules, specific tasks, and specific and clear coordination mechanisms between the sectors. All of these, we can say, enabling environment, it leads to the success of the implementation of the One Health at the national and subnational level. Over from my end. If you want to add anything, Dr. Baher, if I missed part of the question, please remind me. Thank you.
Thank you, Dr. Hiba. I just want to ask all distinguished speakers if they want to contribute to any of the raised questions, so they can feel free to take the lead. So moving to another couple of questions that raised the role of the quadripartite and international organizations and even non-governmental organizations working in the field of public health across the world to support the capacity building activities across the region. So may I ask you, Professor Hashimi, to list maybe maybe 2 or 3 priority actions to support capacity building across the region. So,
okay, yeah. You mean through the quadripartite or through the activities of the strategy of the quadripartite? Is it
yes,
the question? Yeah.
Yes,
okay.
guided by
yes, they already, the quadripartite are already playing an important role in different countries in order to support local and national strategy. I can testify for Tunisia, for example, there is, let's say, many occasion and opportunity and technological support that came from this United Nations organization in order to help the country on how to elaborate strategy against the threats of One Health threats. I want to make one just in addition to what Hiba said about the plan of action and the national strategy in order for more resilience against One Health, in addition to the different, let's say, activities that could be done. I think it's important for the technical activities that are driven by science, driven by the expert, driven by the people who know the field, etc. This is one point. Another point, I think that we have, in addition to the coordination activities of, let's say, of One Health trades and One Health strategy, this should be soft and it should be not too complex. And what is, for my opinion, the most important thing is to have plan of action with technical group. We can have many plan of action, and each plan of action should target one threat that is a priority for a country. It means one plan of action against vector-borne disease, antimicrobial resistance, food, etc. And it's very important for each plan of action in one country, and also for some region and for some collaboration between countries, etc., to have the scientists, to have the expert, to have the people who know these topics in order to collaborate. We can imagine, for example, not to have all the different departments in all the different programs. It's better to have specific programs, plan of action with technical groups to work together, of course, with the different, let's say, specialities, with the different origin of people, veterinary, medical doctors, and others, and data science, etc. And this could be something important for the let's say, for the developing the capacity of different countries in order to be able to reduce for more resilience against One Health threats. So now, again, for the quadripartite, I want to see some concrete action in the field in addition to what is the technical assistance and training and exchange, because we need to see some action in the field. We know we want to see in the universities there is some module that will bring different specialities in order to focus on at the interface between let's say medical human medicine and veterinary schools, etc. We want to see other action in the field. For example, develop research and development in order to develop some tools that are very important for the surveillance, for the using artificial intelligence. We want to see the promotion, for example, vaccine manufacturing, especially for our region. You know that by veterinary vaccine, for example, we can reduce the use of antibiotics in animal, also in humans, and this is a way to, let's say, to operationalize the One Health strategy on concrete action for the region. And we need this in our region. And this, if we need to develop, we need to have, let's say, to promote innovation, to promote startup, to promote public-private partnership in order to develop all the different tools that can help the people to develop the strategy and to, let's say, to operationalize the One Health strategy for better protection against One Health threats.
Thank you, Professor Shimi, for your response. And I know that we may need more time to elaborate more on these specific areas. However, thank you for the comprehensive answer. So please, Dr. Fernanda, if you can just give us a quick guide on how can we improve data sharing and overcome challenges related to data sharing between different sectors. How can we make use of platforms like event-based surveillance, initiatives like 717 in improving the early warning system?
Thank you so much for this question. And as I am sure people who are attending this already understand, just from the questions we got, I see people understand that the issue of data sharing is very challenging for many different issues. My expertise is on the technical issues, but there is a lot of political will. There's a lot of different privacy issues. So it's much more complex than we can address just within the framework of One Health. But I think the main issue is that when people have shared data, they didn't always feel it was giving them value back. People often talk about the privacy issues, but I think if collective we felt that every time we share data, we get a lot of value out of it, we would be willing to share a lot more. There is, of course, a lot of political sensitivities and people are sometimes scared. But we work on these from two sides. The operational side, let's say, the implementation side, right? It's making sure that when data is shared, you give value back. The other is creating the technical tools that allow that sharing to be effective so that we can generate that value. So we do a lot of work at FAO. We have developed a reference data service to negotiate data, for instance, between systems from public health and animal health, negotiate data standards for how we express diseases, how we express animal species. The idea is that the technology is in place, and we're contributing to that through this reference data service. The technology is in place so that should people ever want to share data, we can show them directly what is the value added, and that value hopefully will catalyze it. We have a discussion at FAO. We are planning a regional discussion in Africa in November to discuss across countries how do they feel we could share add value to data sharing. So what is the value you would want to get back from your data for you to be incentivized to share? And I think we have to be more upfront with sharing success stories, right? When did it work? How did it work? So that people feel encouraged to do so. It takes time, but I think with those success stories, we can start showing the value of it.
Thank you, Dr. Fernanda, for the answer. And moving to Dr. Wendy, please, you highlighted.
Sorry, I think Dr. Wendy had to leave.
Oh, so no problem. So we can move to Catherine. I know that Dr. Wendy mentioned that she has another meeting just after our webinar. So moving to Catherine, please. One of the questions that were raised from participants in this webinar is how could the financially stable countries support other countries that are struggling with securing needed funds to support the multisectoral coordination mechanisms and adapting One Health approach within their context. Please, Catherine.
Okay, thanks a lot. Yeah, there's been lots written about, how to finance, let's say, sectors and particularly health threats, guarding against health threats. Most recently, I think, to the WOA, the World Organization for Animal Health Conference, there was a paper that was submitted on sustainable financing for animal health that's worth looking at. But I think the question needs to be asked, who benefits, when you look at who should pay, right? And of course, if there's always the philanthropic side of things, but indeed a lot of times, particularly these days, countries will need to ask themselves, well, what am I benefiting? And if it's a cross-border threat, I think that's where countries can indeed be motivated to pool resources and share together. But there's always this element, like I described with the pandemic fund, one can give, in effect, grant money, free money, but that money will always come to an end at some point. And how do you build the building blocks of sustainable financing? So whatever countries decide as a mechanism, there needs to be some incentive for the country itself to invest, even if it's in kind, even if it's policy, but some steps to show that this is a priority. And given the global landscape, countries are very much asked to pay for things themselves or get a loan, as in the first instant, right? And taking a loan, we really do need economists to come in and say that this is a very good investment. You're going to save or you're going to see a return. So I think we have to take responsibility in One Health to manage, what we're asking governments to spend themselves, and indeed what they might take a loan for, because you might be finding ourselves saying, well, at the end of the day, you have to spend over here, but you're taking from education or from some other part of health. So it's being very responsible in working out what the key priorities are, who benefits, and to pool those resources together with incentives for longer term financing. And I think was mentioned here, how to engage the private sector, not to give the government money or to give the UN money or to give a CSO money, but to actually, have some skin in the game and say, whatever I do even in a livestock value chain, that I'm going to invest responsible for One Health ends. I think CSOs and NGOs, you reach the last mile. I think you do an amazing job there, and increasingly we as the UN system and the banks and others are asked to actually pass money through to you for you to deliver, with our, if you like, technical or even operational oversight, because we have to be accountable. They like to put us in the middle, be accountable for the funds. But the more we work as a coalition, the more we work together in a geography as well as the globe, I think that's the way to show efficiencies and long-term effectiveness. Thanks.
Dr. Baher, you are muted.
Thank you, Catherine. Maybe we can understand such questions based on the fact that no one is safe until we are all. For all the speakers, once again, as we come to the end of today's webinar, I would like to extend our sincere appreciation for the distinguished speakers for dedicating time not only to have this 90 minutes with us in the webinar, but also the time that they used to prepare for this webinar. Today's discussion highlighted that while One Health is widely recognized as an essential framework for health security, however, we still need to explore how to translate these terms into sustainable actions in our daily routine. The discussion also reinforced the importance of strong multisectoral collaboration and regional partnership to address the complex health challenges that are facing our region and even the globe. We hope that today's webinar has provided useful insights, practical lessons, and new opportunities for collaboration. On behalf of EMPHNET, thank you once again for joining us. We look forward to welcoming you in next WEBi sessions. Have a wonderful day, and thank you for your participation. Thank you all.
Thank you. Thank you, Bob.
Thank you.
Thank you.